Buenas tardes, con el diaton mga compoblanos de la ciudad de Zamboanga. Bienvenidos con el diaton na presscon for el Mayo 7, 2020. So, quiero lang kita sacar esta oportunidad para informar con el diaton mga vivientes el mga suceso que pasa na diaton ciudad acerca del diaton pelea contra el Covid-19. Na aspeto de legislación, quiero kita informar con el mga vivientes del ciudad que el Consejo del Ciudad ya aproba 4 ordinanza del ayer. Ya tiene kita la ordinanza authorizing the free burial of COVID-19 patients in public cemeteries in the city of Zamboanga. Y también el ordinanza que amienda con el ordinanza número 532, otherwise known as the COVID-19 Emergency Ordinance. Y tiene también kita el ordinanza que crea y establisa con el diaton cremation and columbarium services in the city of Zamboanga. Y también el con todo importante el ordinanza que hace pasar con el diaton supplemental budget number 2 que tiene el valor de 599,991,871 pesos and 51 centavos, incluido aquí na diaton supplemental budget amo el fondo para la construcción de mga facilidades de cuarentena, el construcción del diaton mismo laboratorio, el comprada del mga equipo para na diaton quarantine facilities y también na diaton COVID testing center, mga medicina y otro pa mga supplies de laboratorio, el gastos de renta que tapaga kita para na quarantine facility del diaton mga health workers, y también el construction del diaton crematorium and columbarium, el provision of additional hazard pay to our health workers, y el con todo importante, el comprada de mga comestibles, el 25 kilos de arroz, y también el mga delata y gulay que dale na diaton mga caserías, y el pago para na Samselco y Zamboanga City Water District para na mga consumers. Este tiempo ay manhunto ka natin el diaton mga resource persons, Dr. Dulce Miravite, our City Health Officer, Dr. Elmer Apolinario, our City Disaster Risk Reduction Management Officer, Dr. Justin Paber, the spokesman of the Zamboanga City Medical Center, Senior Jail Officer 1 Ray Lawrence Comprendio, el portavoz del diaton Zamboanga City Reformatory Center, y también el mga oficiales del Zamboanga City Electric Cooperative, si Mr. Bernie Barliso, el Finance Manager, si Engineer Fredericks Baco, el Corporate Planning Head, si Mr. Rowie Endaya, el Administrative Head, y también el Technical Head, si Engineer Mel Chu. At this point, we shall now listen to the opening statements of our resource persons. We shall have Dr. Dulce Mirabite first.
Okay, so thank you, Attorney Kenneth. Good afternoon, everyone. So today, we have a total of 611 COVID-19 suspects, 60 confirmed cases, and 3 confirmed mortalities. We have not received any confirmed positive results, and we do not have no confirmed mortality. 5 of our confirmed cases are admitted at Zamboanga City Medical Center. We have a total of 553 specimens that were sent for testing. Out of these, 358 are already with negative results, and we are still waiting for the result of 137. We have 42 present admission at Adzu Lantaca Isolation Facility. To date, we have a total of 96 suspected COVID-related deaths, an additional of 14 for the last 2 days. 75 are from Zamboanga City and 16 are from outside the city. 37 of these deaths are with negative results already and 11 pending and 45 not done. Most of our deaths come from the ages 40 years old and above. For the update on our City Reformatory Center, so we will, right now we have scheduled the testing of the BJMP personnel along with the other close contacts or those with high risk of exposure, both from our male and female dormitory.
Please continue, Doctora.
Yes, that's all.
That's all. Thank you very much, Dr. Dulce. We shall now listen to the opening remarks of our City Disaster and Risk Reduction Management Officer, Dr. Elmer Apolinario.
Buenos días, pueblos Yesterday, together with Mayor Beng, we met with the judges of the various salas aquí ng Pueblo Zamboanga, and principally this was to our jail warden, Nathaniel asked, regarding the we have protocols already in place to be signed by the mayor by today. And of course, I'd also like to report the public that yesterday we were able to agree with the approval of the chairman of the Zamboanga City Economic Zone Authority, providing the city two additional quarantines in their area. That makes us to have a total of 4 already. And also, we are trying to negotiate one more facility, a seacraft, where we can also put forth some of the persons to be quarantined. So these are all things under being negotiated, and we hope to have the quarantine facilities at the Zamboanga Ecozone facility. Hopefully, 2 will be operational by Sunday. And that is all, Attorney Ken.
Thank you very much, Dr. Elmer. We shall now listen to the opening remarks of the spokesman of the Zamboanga City Medical Center, Dr. Justin Paber.
Good afternoon. Good afternoon,
Good
everyone.
afternoon, Doc.
Presently, we have the 5 admitted COVID positive patients in Zamboanga. Happy to announce that these patients are presently stable. We have additional of 83 other COVID-related cases admitted at the hospital. Presently, Zamboanga City Medical Center already started its gene expert testing yesterday with a total of 23 patients tested on its first run. Good also to know that all these 23 patients tested in the first run tested negative. Thank you very much, Attorney Kenneth.
Thank you very much, Doc. Ahora uwi también kita con el opening remarks del portavoz del Zamboanga City Reformatory Center, Senior Jail Officer 1, Ray Lawrence Comprendio.
Yes, good afternoon a todos. So just an update of Zamboanga City Jail Male Dormitory. So we are still on lockdown and 44 PDL, ali pa syempre house na di ato na basketball court, and with 2 personnel who are isolated inside the compound, and of course 1 PDL, or I should say 1 HR palda na Zamboanga City Medical Center, and pending palda mo request for another swab test na di ato na infirmary. Good afternoon.
Thank you, SJ1 Comprendio. And now we shall listen to the opening statement of Mr. Bernie Barliso, the finance man.
Good afternoon, everyone. Samselco continue to operate to cater the member consumers in as far as the supply, ensuring the adequacy of supply of electricity. At the same time, we are open for collections, and for those member consumers who would like to pay their bills, Samselco accepts the payment, and as well as other authorized collection outlet of Samselco. Just recently, we have received an advisory from the Energy Regulatory Commission, further granting a grace period to our member consumers in their payment of electricity bill. So this is referring to the deferment of electricity bill, particularly for our bill of March and April bill. They can pay this in 4 equal monthly installment payable in 4 succeeding months following the end of the ECQ. We will be issuing an advisory related to this matter to inform our member consumers.
Thank you very
That's
much.
from Samselco. Thank you.
Thank you very much, Mr. Bernie Barliso. Ahora ay prinsipya kita mga pregunta estaba con el mga miembros del prensa. For Dr. Dulce Mirabite, el mga pregunta estaba con Albert Luna. Chenia ba kita update na di aton Ecozone Isolation Area? Quando el target date for its operation? Can you answer that, Doc, first before I proceed to the next question? Doc Dulce?
Yes, we are grateful ganit na di aton Ecozone Chairman for letting us use 4 units as isolation facility. So 2 are already under construction, and hopefully within in the next 3 days, we can use it already. So next week, pwede agad kita ko nakalusa as an isolation facility.
Okay. Siguiente pregunta estaba con Albert Luna. ¿Por qué queda silencio el resulta del mga COVID patients del alcaldía sunod-sunod gayot? Kilaya ba el schedule delegada del mga results?
Yes, sabi to, gani kita, as of now, gani kita 137 pending results. So, este mga samples, gani kita for testing. So, we do not really know tamen pakilaya el bulk del testing na di aton mga testing centers on the kita tan send ko neste. So, as soon as they run it and as soon as they have the results, tan email sila kanatun, no? So amo siya ta pwede kita sa kakunel result. That is why we are happy that the ZCMC ta pwede kita chenia kita pwede man run gani according to Dr. Justin yesterday chenia kita Gene X. So el Gene X di aton within the day ta pwede kita sabi el di aton resulta. And the same with our if chenia kita gani functional PCR machine akika naton. So mas pas mas unrato kita pwede saka LD aton result. So for now, si Tansen kita el result, depende gani. So it would take the shortest is 2 days and the longest is 15 days. And sina LD aton turnaround time del di aton results del testing.
Okay. From Julie Alipala, Doc Dulce, how many children died as COVID suspects? Were they tested, and how many of them were tested? And from what barangays are these children?
Okay, so I actually gave a copy del di aton summary kun Ma'am Sheila, but we have 0 to 8 children, 0 to 9 years old, LD aton deaths. So 5 are with negative results already, and 3 are not done. And 4 are from outside Zamboanga City, 4 are from the city.
Okay. Another question from Miss Julie Alipala. A 12-year-old child died. Accordingly, el mga parents gani del bata are ambulant vendors in front of the City Reformatory Center. Was the boy included in the list of deaths of COVID suspects?
So far, I have a 12-year-old here in my list, male. Unfortunately, nuay kunele sa ka specimen, not done LBC specimen, pero chaniki 12-year-old male na di aton lista.
So,
I don't think parang kosa kita pa sa kano, what's our gain if we're going to manipulate our debt. So we have our data as it is. So if kaya
to barangay and town.
we have already given a copy to Ma'am Sheila.
From Roel Pareño, Doc Dulce, if the succeeding test will show adverse or positive results, does the city have enough isolation centers, medical staff, and other needed requirements to the big number of patients?
So right now we're preparing our 4 isolation units, and we see that we need to add our isolation facility na we will identify other areas. So all of these things that we need, we are preparing already.
Okay, thank you, Doc Dulce. We will go back to Dr. Dulce. We will now proceed to Dr. Justin Paber. Doc Justin, ¿cuándo oficialmente man-test sample el Zamboanga City Medical Center Laboratory? How many samples tested and what are the results?
We started our official testing sa Zamboanga City Medical Center using our Gene Expert machine. It is also similar to the RTP or to the PCR machines. Yesterday, we were able to get a total of 23 tests Fortunately, all the tests came out as negative. The PCR machine is able to run around eight tests per hour for eight working hours. So that's the total number of tests we can do in a day. Foregoing any untoward incidents to our machine or to our staff, at least a 64 as far as Zamboanga City Medical Center is concerned. According to our pathologists and our microbiologists, once we have the laboratory in the Department of Agriculture functioning, that facility can handle at least 180 tests a day.
Okay, so I think that answers the questions of some of the other members of the media, like the question of Kati from Brigada News and RG Go, and the rest. So we'll now proceed to the other questions. What's the status of the patients that are admitted in the Zamboanga City Medical Center, Doc? And do we still have enough beds to cover in case tiyan pa mga additional patients?
As far as our COVID patients, our COVID positive confirmed patients are, they are all stable. So thank God, buenamente sila. We're having a hard time, presently, with bed spaces for our COVID suspects and the COVID. Zamboanga City Medical Center, we are running out of beds. We prepared for 104 total beds for COVID-related cases. Among this, 70 is allotted for our adult patients and 24, the remaining 30 is for the pediatric patients. We only have spaces for pediatric patients left. As far as the adult patients, are already full. So that's why we're really happy that by Sunday the step down as well as the isolation facilities will be operational. So this will enable us to decongest our adult patients and then bring them to the step down facilities and also the quarantine facilities.
Okay, thank you, Doc. In relation to the question on our laboratory at the Zamwanga City Medical Center, you stated that there were 23 tests rather. So would you please disclose cosa el resulta de este, Doc?
Good thing all the 23 tests done on the initial run were negative results.
There's a question from RG Go, Doc Justin. ¿Cuánto test kits tiene for the Gen Expert?
For the Gen Expert, Zamboanga City Medical Center was given only 1,100 test kits. So these are the only Gen Expert tests we had. Total of 3,000 was given for the entire Philippines. We were able to get the bulk of it. 3 other hospitals received around 600 test kits each.
Okay. Doc, no, for emphasis lang, no, kaya baka no sila pwede uwi, si Theodiver, ya priguntale, chene ba swab specimen, yaman test na CCMC Gen Expert machine?
As mentioned earlier and repeatedly mentioned since my introduction, we already had 23 tests done yesterday. And all these tests came out as negative.
Okay, thank you very much, Doc. And then we shall now proceed. We will go back to you, Doc, if there are other questions. We will go back. We will now have our jail warden. In behalf of our jail warden, SJO1 Ray Lawrence Comprendio will answer the questions. SJO1 Comprendio, sir, what is the update on the releasing of persons deprived of liberty?
Yes, okay.
Proceed.
Okay, yes, good afternoon, attorney. So actually, our PDL who are due for release, nasa quarantine area sila, and then they are still waiting for the ato na decision of the CHO.
Okay. Cosa el condition del mga positibo persons deprived of liberty y también el mga BJMP personnel y otro pa mga inmates ali adentro con ustedes?
Yes, actually, at this time, the aton 44 confirmed PDL, kaya sa ligani positibo na COVID-19, kadi sila actualmente na di aton na basketball court, and isolate kita. And then, as per hindi lang mga attention, kaya dali ko ng mga PDL every day.
Okay. We will go back to you, SJ1 Comprendio. We will now go to Dr. Elmer Apolinario. Elmer, we have a question from Shirley Espino. Do you have the data on the number of persons deprived of liberty who are now under quarantine, and how many are expected to be released soon? Doc Elmer? Okay, so we will just go back to Dr. Elmer Apolinario. We'll now proceed to Samselco. The first question for Samselco. The payment of bills in Palawan outlets, main office, and other collection outlets caused mass gathering of people with issues on social distancing. Are you planning other modes of payment to address this issue?
Yes, sir. Good afternoon. We're actually working with a different mode of payment, no, for our member consumers who wishes to pay through GCash or through online banking. But we are still processing that. We are ensuring the procedures and data integration. So as of this point in time, we are still in the process of engaging those type of modes of payment. Though we are overwhelmed with the number of the paying consumers here in our main office as well as in our sub offices. We are intensifying our efforts in ensuring that the social distancing directive is being implemented. So among those is we have contained them in our big gym, wherein we ensure that each and every one of the member consumers are seated not less than 1 meter or 1.5 meter apart to ensure that there is no physical contact from one consumer to another. So those are the activities or the measures that we are implementing here in our main office and as well as in our sub offices.
Okay, sir, there's a question here. In the initial stage of the enhanced community quarantine, there was an announcement that some Samselco will defer the collection of payments from consumers. How come you are calling for the payment of bills with corresponding arrears? Please explain.
Yes, sir. No, we issue the advisory pertaining to the deferment of power bills. I think most of our member consumers, despite our advisory in our Facebook page as well as some of our radio outfits, most are still paying their current bill for the month of March and even for the month of April. But based on that advisory, we are informing the public that they can opt to defer their payment of the power bill. So they need not to pay their bills, but we provide options for those who wanted to pay their bills in full. They can do so in our different collection outlets.
Okay. Can you please explain your proposed installment plan for bills payment?
Yes, sir. No. Particularly for our bill of March and for our bill of April, this is effectively deferred. In other words, if the member consumers opted not to pay their bills in full, it will be deferred in 4 equal monthly installment. Rather, they can pay it in 4 equal monthly installment. This will start in May bill and the succeeding bills, June, July, August. Yeah, in other words, if they wanted to defer their bills, they can do so. And if they wanted to pay their bills in full, they can do so. This deferment of electricity bill is a mode of providing a grace period to our member consumers, no, particularly those power bills that whose due date is falling, which due date is falling within the ECQ period. Our consideration for that ECQ period is from March 16 to May 15, since we extended our ECQ until May 15.
Okay, sir, question. Why do we continue to experience power fluctuations? And what is the new Samselco doing to put an end to this problem?
Hello, sir. Good afternoon. I am
afternoon.
Frederick Baco from Corporate Planning.
Yes.
So,
Proceed.
relative to that fluctuations, incidents of voltage disturbance this past few days, there were emanated, as we all know, that and explained to the public that the fluctuations emanated in different factors, like it could be emanated from the generators, transmission grid, and in our distribution lines. No? Now, relative to that past few days incidents, they were emanated from our distribution lines facilities. There were feeders of some Selco distribution lines had experienced three-phase fault. So, meaning to say, in layman's term, the primary lines of distribution is being shorted due to the branches of maybe branches of trees and so on. Okay, so that is causes that what we commonly known to the MCOs, the voltage fluctuation. Okay, there were also findings that the voltage disturbance occurrence due to the equipment operation from NGCP. It has something to do with the timing of equipment operation. Equipment like the capacitor bank installed in different substation of NGCP, especially during the lean hour or during the off-peak time or period, and the synchronization of the WMPC plant generators. So that is the reason why this past few days we called up a meeting and convened some of the personnel from NGCP, WMPC, to resolve this issue and come up with, of course, the solutions. So we agreed, and NGCP and WMPC agreed to have some protocols prior to the synchronization of WMPC. Now, however, we still have a problem because the grid remains vulnerable at any time. Our MCO may still experience the voltage disturbance. This is because the SBC equipment of NGCP at Naga still need to be repaired. The SBC, or the static bar compensator, as what we know, is the one responsible in regulating the grid voltage and the reactive power support to the grid. So we asked that update from the NGCP as to when they can be repaired, that equipment. So based on the response of the NGCP, the repair of that equipment requires the foreign expert to do the task. But due to the COVID-19 pandemic, the expert personnel cannot come. Hence, the scheduled repair of the equipment was put on hold.
Okay. Sir, there are several questions here because there are so many areas in our city where there is a power fluctuation almost every night. So because of that reason that you relayed, that the person who is going to do the repairs cannot come here, are they going to expect that these fluctuations will be the new normal also insofar as their power connection is concerned?
I think it's not that the case. As the NGCP said, if the foreign expert can already visit or travel going to their area, that equipment can be repaired.
So there's no problem with our transmission lines. Is that what you're saying, sir? It's the NGCP's problem?
As I've said, sir, earlier, there were factors that contributed to the voltage fluctuation. So first, number one, due to generation. Second, the transmission lines pertaining to the NGCP grid. And then the third one, the distribution lines, our distribution lines. So from the cooperative. So in our case, from the Samselco ends, we are still continuing the line clearing activity, as I've said earlier. And just to mitigate the impact on the voltage fluctuations due to the faulted lines.
Okay. Thank you very much, sir. Just one question from Teodiver Arquisa. According to him, the bill for April has doubled. I don't know if he's referring to his own bill or the bills of several other consumers. So he's asking now, is it possible that the consumption for March could have been included in the billing for April?
Yes, sir. No. To answer that question, no. Really, we have noted that the surge in the power bills was due to the increase in the energy consumption of our consumers, particularly our residential member consumers. This is during the time of the ECQ period, no, which started in the middle of March and even up to this point in time. If you recall, we have suspended our meter reading and tendering of bills activity during March due to the threat of COVID. So we want to ensure the safety of our based on the average consumption, no, of for the past 3 months. This is consistent with the available method or procedures provided under the DISO rules as promulgated by the ERC. We have noticed that the impact of the ECQ to the energy consumed by our member consumers was not really captured, no, during the March bill. Because sabi ko station, average kita using LD aton past 3 months consumption, and that past 3 months, which is referring to February, January, and December, na normal situation hindi sila under na ECQ. When we actually get the kilowatt hour, when we actually read the kilowatt hour meter of our consumers during the April, talya abuya el actual consumption behavior del aton mga member consumers, particularly the residential consumers. So in that case, el change in the actual energy consumption behavior del aton consumers during the ECQ period, apparent. It became apparent, no? Moreover, el impact del ECQ in the energy consumption del aton consumers made worse because it happened during the summer period when the warm weather conditions demands more power requirement. That is correct, no? Posible or siguro for most of our member consumers, portion of the energy consumed during the March, which was not actually captured because we did not perform an actual reading, was carried forward to April. So por eso, most of our member consumers, yan search got dila electricity bill for the month of April. We would like also to inform the public that Samselco, no, as far as our rates is concerned, we did not have an increase in our rate comparing the aton March rate and April rate. In fact, we reduced our residential rate by 15 centavos because of a lower generation cost. At the same time, yung mga charges na di aton unbundled rate, yung man suspend ang collection to help the aton mga member consumers, no? We would like also to inform na hindi kita kere no man to put more burden na di aton consumers. In fact, we have written our power suppliers asking them to reduce posible sila man reduce capital recovery fee. Also, we have written our power suppliers for a payment extension, which positively they have responded. Si Tamanrico Taminostedes, kita sa Sali Advisory, no, akal pantawid liwanag program, giving free electricity for akal mga residential member consumers daton eligible kunakal daton programa. And there are some other CSR programs naman implement Samselco. We wanted you to know that Samselco is supporting our member consumers, and this is to show that we are one with the national government in this situation, no, of health pandemic. I would like to say na pandemic situation truly yaponika natin na environment na nisita kita mira no tiyan kita perspective that can better see and understand no consequences we have never anticipated. And electric cooperative Samselco is one of those who are greatly affected by these consequences, and dealing with this is the only alternative that we have. So, sir, no?
So, Sir Bernie,
electric bill.
Sir Bernie, para asa kita mas klaro na entendimiento del diaton mga konsumidores, no? Kaya nang kita sa klaro, si Amo Bakel, el tabla 2 del el bill di aton del mes de marzo, Noy kita actual reading, sino ya ni kita averaging for 3 months before it, no? December, January, February, yaman add ko na kaya asel average, amo el ya asel bill for the month of March. Is that correct?
That is correct, sir. No?
Si.
Yan average kita with that kind of method, no? Allowed man sa by the rules del ERC of the several method. That is one of the method, no? No ele pwede man capture get el actual consumption del diaton consumers for the month of March. Could
Si.
have been ya kita actual most of our member consumers. So having said that, el effect del energy, more energy and utilize kita or increase the consumption di aton ara, un poco ya karga aki na April, kaya alya kita ni actual reading
Si.
del April.
Kay mayor parte dal diaton mga konsumidores, talya na kasa, so tausa ko nal dila mga appliances.
Si. Uno taming galese para debe kita miran, no? Kay, syempre, no pwede, kay because of the situation. These are little things na we don't really notice, no? But continuous consumption del power di aton, alya na individual houses di aton, has really contributed much na higher consumption del di aton electricity. In fact, in our records, we have registered that for this month of April, no, pati March, kita alto consumption or sales na di aton residential consumers. Opposite ele na commercial di aton, kay mostly del daton mga commercial establishments sera uli for the month of for the middle of month of March towards the end of April.
Okay, thank you very much, sir. We will go back to you if there are additional questions. We shall now proceed to Dr. Elmer Apolinario. Doc Elmer, are you there already? Doc Elmer?
Yeah, buenas.
Yes. So, sir, we have questions from Shirley Espino. Do you have data as to the number of persons deprived of liberty that are now under quarantine? And how many are expected to be released soon?
Well, per information given to us in a report submitted to the mayor by our city jail warden, dated yesterday, May 6, there are 234 persons deprived of liberty scheduled for release. These are people with already release orders, of which 5 in the said center, positive with 5 COVID-19. 34 of which are residing at cells 15, 20, 21, 22 infirmary and quarantine area. We have 92 that lacks documents, and so our documents are still being checked by the appropriate office. And we have 60, as reported by Dr. Dulce, that have already been swabbed or tested, and 43 are ready for testing again. So these 234 are with release orders, which is why yesterday we had a meeting with our RTC and MTC judges. They were there in full force. We also had our city prosecutor and the other partner agencies, and discussion was centered on how to go about the process. And principally, it's centered on the need for the city to have quarantine facilities for our PDLs, and which is why in the coming days, we will have them possibly tomorrow or Saturday already quarantined in these areas. And which is why we have also requested our city health officers, our city news office, to fast track the preparation of these facilities. And good enough, yesterday in our meeting too, the chair of the Zamboanga City Economic Zone Authority, Mr. Raul Regondola, had acceded and provided 2 additional quarantine facilities in the Ecozone property. So bringing to a total of 4, of which 2 will soon be ready. Each facility is able to accommodate no less than about 60 or 70 quarantine persons. And we have also made some arrangements, negotiations, and hopefully it will really materialize for a CCRAP to also be one of the facilities for our COVID patients.
Doc Elmer, in relation to that thing that you mentioned now, do we have other quarantine areas aside from those mentioned? This is a question from Theodiver.
Yeah, we have. In fact, we have one in Lantaka, we have one in DOH, Kabatangan. We also have a small facility, the evacuation center in Kabatangan, which was recently completed by DPWH. And of course, I believe we have another one soon to be identified, but we're working on arrangements yet.
Doc Elmer, in relation ko na pregunta anante aser kakal mga persons deprived of liberty, chene question si Sai Cortez. Kwanto ba dal mga persons deprived of liberty ke chenia release order ya dalal di aton mga huwes el yan release ya for this month. Iko sa el proseso si man release kanila.
The report no, the Chief Jail Warden Alhas, 234 él tiene release orders. Por eso, kasi kami pura ara ese día, para poder firma si Mayor Beng, el protocols que agree kami with the recommendations given by our city health officers, si Dr. Dulce, and of course, those also taken from Department of Health, the RD Municipal, and of course, from other also health, health specialist regarding estigane type ng problema, no? So talisay, tsaka may protocols in place, this have been approved. So we're working on the executive order to be issued by today, and this will be the guideline on how to go about the process of our PDLs. Mind you, attorney, no, we've made it known ayer kung mga dito mga huwes, kay hindi kita preventing kanila sa apuera, because that is their right. They are already with this order. We're just asking that we process them. For so say, yes, si Dr. Dulce el require swabbing and then more are coming because we want them out in the community. But we will have to provide the facility or the quarantine where they will be temporarily housed for 14 days.
Okay, gracias sir. Kaya lang kita omenta akal ta ablas si Dr. Elmer kay este diaton mga persons deprived of liberty amo sa el mga detainees tali adentro na city jail donde gane yadali el mga juez diaton ang mga korte un orden para mandaya kanila sale kaya pwede sila man serve no el minimum del dila sentence or in cases donde ganiyan plea bargaining sila. So este mga sitwasyon ansina no hay masya jurisdiction el korte kanila kaya chenia release order debe ya kanila mandasale. Pero el diaton konseho lokal tambien por causa kun akel meeting junto kun el diaton mga huwes ya ase entra na diaton ordinansa donde gani tabla kita el mga persons deprived of liberty ay mandated sila to undergo a mandatory quarantine para asigura kita kay hindi sila asikalayat kunel enfermedad sibira sila na dila maga kadaikwalan komunidad. So Dr. Elmer, in relation to esegana diaton sitwasyon na diaton city jail, chene taming kitali facility for our female detainees. So question from Ermi Ventura, kosaya ba el plano aura aser kagane kun este maga female inmates diaton por causa nuay gane kanila por sige kambya na central school. So kosal maga plano kaya impone kita para gane preveni con el contagiada del enfermedad. Ichene ba lokasyon donde ta proposita pone kanila?
Well, el diaton kalikwan, no, el arrangement kita, etienne kita, when we had the meeting with our jail wardens, specifically ko del mujer, si April Joy. So, talaga lang kami, adentro lang siyempre sila ka, they will not be brought out akil na legal facility akil on the central school. They will have to be maintained in the present area where they are confined, but we are going to monitor. That is why we have taken a proactive stance together with the health officials to see to it that they are being monitored daily. In fact, we just received a text message from our wardens kay nila sila started sa mga inmates ali, tadali vitamina, tadali kosa requiremento para prevenir el problema que agrava. So este tasita daily monitoring, they give out reports to us, any assistance that they may require, we immediately respond together with our city health office. Among sa tasita no, this is a priority on the part of the local government to look after the needs of our inmates in the city. That's why we are in constant coordination with the jail warden and his personnel, together with the health officials, kita Pueblo Zamwanga.
Thank you very much, Dr. Elmer. Dr. Elmer, the next question is in relation to the balik probinsya program donde gane tamanda kita bolbe no kunal diaton maga kompoblanos ketali na maga otro lugar. Pwede ba to dalel update na proseso kita prepara el dito yung opisina Aura?
We have started the process initially, what are the requirements needed. But very recently, the other day, there was a memorandum issued by the mayor designating a specific office to handle that. In fact, Ms. Rita Hernandez, our tourism officer, has been tasked to precisely do that together with the staff, because they found out that there is a need for a designated office to address, because initially we thought only a few hundreds, but now it appears being manada ngayon. So there is really a need for that office to already take cognizance of this issue in bringing back most of the stranded residents from other cities, and of course also to work a mechanism on those who are also stranded in Zamboanga City to go out also, particularly aquel quieren trabajo afuera del Pilipinas. Por eso, ganese, initially we did coordination work with the OWA, si Regional Director Pres C. Flores was very gracious to assist us. In fact, si Director Manny Ochoturrena also provided us some avenue on how to address the problema through the Philippine Air Force. And of course, el Dieto Assistant Secretary, si Myra Abubakar, has been on board with us, assisting us, just to go about the processes, no? So all of these things we have done initially, and we're going to relegate this function to the City Tourism Office headed by Ms. Rita Hernandez to take the lead in bringing about or bringing home our stranded residents, and of course addressing also some of the needs that are pertain to those who are stranded in Zamboanga City but needs to go back to Manila and ultimately trabaho nila afuera.
Okay, thank you, Doc Elmer. And then, este tamen na question, Doc, ya pregunta man ste kun Dr. Dulce, pero siguro ito el negat mas mucho detalye as para el diaton na gobierno lokal este maga tiempo. Cuando ba este queda preparado ya para recibir maga gente?
Well, el diaton ko kel na ko, so as I was discussing earlier, cuatro kel no. Two of them will be ready by Saturday or Sunday, and tablakan ito, el first warehouse will be completed on Saturday, and the second warehouse will be completed possibly by Tuesday. Third and the fourth are now being prepared also, and tablakan ito, mga amenities are in place will be toilet, male and female. The area is 8 feet by 8 feet, so there is social distancing ngayon. And then we are able to about 68 per warehouse. So totally, mas de 200 si po entral yan, no? So to say, well ventilated, there is a decontamination area. All of these things done were in coordination with our health officials. The city health office was on board when this was prepared. And there were also other suggestions given to us. And even si Secretary Vince Hizon, when he was here, presented and provided us information on how to go about the construction of mga quarantine facilities. Similarly to what is being done in Clark. Pero tablakan na kita, we really would want that this be accomplished as soon as possible time, because we want this facility to be ready for use immediately, as has been requested by Dr. Amiravite.
Okay, thank you, Doc Elmer. We will go back to you, Dr. Elmer. We have questions for BJMP, SJ1 Comprendio, sir. Talipatu. SJ01 Comprendio.
Yes, sir.
Si El pregunta, sir, no estaba na na brigada para na BJMP, tabla sila kaya receive sila reports donde chene daw yan release maga persons deprived of liberty, salia afuera. Verdad ba este, sir?
Yes, good afternoon once again, attorney. So as to the release of PDL, definitely they are closely monitored na atong quarantine area, no? So pending result of the swab test, that's the time kita kanila man-release. But as to this present time, no any uno kanyan release kanila. And in addition, tiyan kita 44 también, no? On process PDL due for release, and of course pending tamen state swab test.
Oh, so, sir, in relation ko na sa pregunta, tiyan question si Julie. Hablale, cosa ba el proseso si man-release con ese 234 PDLs? Will it be by batches? Onde sila anda? Will the barangay receive them? Cosa el role del barangay?
Yes, actually, 60 PDL y también 44 due for release. Form part lang sila del total 234 PDL due for release también. So, assist kita by batch and of course, taman verify pa también kita dila mga records na court as to the release order, no? And of course, di ato mga PDL, before kita kanila tan release, we have constant coordination with the city health office as to kosa kita ase. And of course, in negative we will directly turn over such a certain PDL to the birth the alina barangay. In tal caso, negative el dila results.
Okay. So, sir, el question también, no? So, ahora, ay bira kami contigo, SJ on Comprendio. Andani kita ko ng Samselco. Sir, we have a question here for Samselco. How much do you dispatch or nominate from WMPC every day? Accordingly, Samselco is getting only 20 megawatts instead of 40 megawatts so as to avoid imbalance in the generators which cause the daily fluctuations.
Okay, sir. Good afternoon again. Now, with regards to that power nomination with WMPC, currently our nomination is the minimum is at 20 megawatt up to 30 megawatt. This is to support and stabilize the voltage level in our system.
Okay. Sir, question from Brigada for Samselco. What is the status of that SMS inquiry bill? We receive a lot of complaints from consumers saying that after sending a message, there is no reply coming from Samselco.
Yes, sir. No, to answer that question, based on our observation, there are consumers who are sending the SMS inquiry not in compliant with the SMS format. Some member consumers send their account number with the type of consumers included in the account number. At the same time, lacking digits of account number. So those are we find cases that are being discovered in our system. Our system is automatically replying to the SMS inquiry. So those are the things that we see. Akal siguro sa mga consumers na akan ito pwede receive ko na reply because of that situation. But basically, most of our consumers has their replies from our SMS inquiry. SMS inquiry, no? I think they have to check lang el format in how they text na the amon system. Secondly, we are receiving volume SMS inquiry during the time of March and even now. El daton system, one by one sa elitan taman reply na daton SMS. So tiyan na lang po jutay de lag na reply, but eventually tan reply syempre sa el amon system na SMS inquiry na daton mga consumers. So I think LDMU lang is mga consumers using el SMS inquiry has to check el format di ila no na inquiry kay mas si iyo tan text yo no tan reply man siguro for those consumers tiyan nga problema na inquiry di ila.
Sir, tiyan pregunta ki si Chodiver, tablale, debe daw akseptaya na Palawan Payment Centers akel mga tiyan arrears para mas kore y menora el gente na mga collection centers del Samselco.
Yes, sir. No. Actually, we have already talked with our Palawan. El kwan kasi el importante sir no. El reference number del aton statement of account. Previously, we issued a statement of account. Akal mga account ni arrears, hindi taabuy el reference number. But when we updated our handheld, akal reading device di amon, akal mga subsequent statement of account, niya taabuya
reference number, no, that is being used by the Palawan in processing processing the payment of the consumers. Now, si Chene to our years, kere to paga konel our years, pati konel current bill, akal diamon SMS inquiry, si man texto alya na diamon SMS inquiry, man reply kel contigo, dali kel contigo el Palawan reference number. So technical reference number dali ko nagkel reply di amon, kung nagkel kentan inquire, akal pwede kita kal presenta kon el Palawan. So with that receive el Palawan si Chene 2 years, but el punto alya nisita to paga el di 2 years pati current.
Okay, thank you for that clarification, sir. Ay bira kami contigo si Chene pa mag-aumento pregunta. Aura, Chene kita mag-pregunta, no? Para na BJMP. Sir, comprendo, tali pa ba to, sir?
Yes, attorney.
El question di Mrs. Letty, Ma'am Letty Militante, do we already have the result of what brought COVID-19 inside the BJMP? Asigun kunele, el mga inmates are at risk to be infected since those infected were only isolated in the covered court. Do the other inmates receive vitamins and nutritious food to boost their immune system?
Yes, actually, LD aton 44 PDL kay talyara confine na di aton basketball court. Daily si LD la sustenance. So dali kita vitamin C every day, and then augment naman kita food like daton arroz caldo, daton pandesal, no dating kita for potassium, banana, and of course milk. So hindi lang sa kanila kita dali. So we also gave equal privilege, no, to other PDL kay akel vulnerable tamen kunel enfermedad.
Okay. So sir, akal pregunta sir, ken ba el cosa el causa ya tiene ustedes outbreak li Kenya liba? Kaya mo tamen sa pregunta di RG go.
Okay, sir, as we have seen three angles, no? Three angles of this situation. First, allow me to give the first angle. So the virus in the jail could be attributed to those visitors who visited in the facility way back March 1 to 13 before lockdown, wherein the earliest locally recorded COVID-19 positive already exist. Possible visitors that have visited the facility in the last days of visitation. It was noted that one of the duly searchers in the facility who had positive contact to a positive asymptomatic visitor yielded positive in the swab test. And then the second angle is the PDL confined at hospital and returned to the facility during the brink of the outbreak, where no test has yet available. And those PDL who underwent DDT in the hospital and returned to the facility. And the third angle is the possibilities of having newly committed persons deprived of liberty in the facility that were possible asymptomatic is not disregarded. As record shows, there were 43 newly committed PDL that were transferred to this facility way back March 2 up to March 13. Ideally, there were also inadequacy that we were not able to require the committing officers. This newly committed PDL should have undergone swabbing examination since the pandemic already existed as early as March in the city. That despite all the remedies and precautionary measures done, upholding protocols on COVID-19 set by DOH and higher offices, authorities, implemented as early as February for the record. Presently, the facility is now facing this pandemic risk. Thank you po.
Okay. Sir, Julie Alipala is asking, what are the cases of these soon-to-be-released PDLs? Are majority of them involved in drugs? And what are the other crimes committed?
Yes, actually, majority of them are drug-related cases and other cases.
Thank
mga
you.
Criminal cases.
And we have a question from Sai Cortez. Tiene ba aki na akal mga positive, sir, PDLs, tiene order for release?
Yes, definitely. Chene kita record for release.
Thank you. Now we have to go back to Dr. Paber because we will have to excuse him as he is pressed for some other commitments. Dr. Justin, we just have a question here from Julie. With the numerous fluctuation incidents na diaton sa Samselco, hindi ba apekta ko ng diaton testing facility? What are the measures undertaken by the CCMC testing sa diaton nuevo pasilidad para asigura ke hindi apektaw ang diaton mga specimens and equipment na mga power surges?
So as we all know, importante ka kita consistent el daton kuryente kina Zamboanga City Medical Center, not just for the testing center but the entire since the start of our COVID referrals facility, our elevators have gone down quite a number of times because of the irregularities in the electricity given to the hospital, the fluctuations. So nadamay na rin po yung mga elevator natin. So we have some reported episodes wherein it failed. As far as the testing facilities or the testing machineries are concerned, they are all backed up by ako tabla kita UPS. So the UPS is installed in these testing machines. However, hindi siya pwede agwanta sa tarda kat el daton mga blackout. The hospital has its own generator, but we also have to consider a length of time na hindi pwede agwanta al hospital na nuay kita kuryente. So hopefully we can address the problem. We have our Samselco board here who can also address the problem, especially at this time, especially the needs of the hospital. Thank you very much, Attorney.
Thank you very much, Dr. Justin Paber, for joining us. So we will now go back to Dr. Dulce. We receive a surge of questions from our friends from the media. Doc Dulce, we have a question from Julie. Kaninong opisina ang in charge sa pag-pick up ng mga taong grasa or those mentally challenged na pagala-gala sa kalsada? Sila ba ay posibleng carrier?
So actually, this is the mandate del diaton CSWD office. But si na sila mga health concern, so ta entratamen el diaton opisina de salud. If we have established local transmission in Zamboanga City, they could be possible carriers. So we have talked this over with CSWDO and we have planned measures to keep them, to also keep them in a certain place so that they will be contained. Hindi sila man to have high risk of the infection.
Doc Dulce, question from RG Go. Do we have plans as a mga swabbing facilities?
El diaton swabbing facilities amya sa El diaton, we can actually schedule for swabs once we have our testing center already functional.
So, do you conduct swabbing in the City Health Office, Doc?
Hindi, no? Tausa kita di aton testing booths on certain areas. So, hindi lang kita undo-undo tan swab tamin, pero tan-keep gani kita so that we will not have undue exposure na di aton tamin mga health workers who are doing the test.
Okay, Doc. Is there
But
still...
we schedule the swab.
Okay.
Yes.
Is there still a need to send swab samples outside of Zamwanga or other COVID-19 labs in Manila or other cities? This is a question from Brigada.
We still have mga kits that we can send outside. So if ever tiyan kita ara tiyan kita Gene X, so tapad kita semanran, if our DA laboratory will be functional, so we can also do the testing there. So we can also send our specimen at SPMC and also at St. Luke. So tiyan kita 4 mga facility only kita pwede man send al diaton mga samples.
Are there additional PDLs who were swabbed? And which lab does the city usually send the specimen of the PDLs to? Where do you send the specimen, Doc?
So right now, actually yung swab kita 60 that are due for release, we will send the specimen to SPMC. So no ipakal pending pakal LD result. And we have scheduled for the close contacts pa siya napakita mga otro nasita pa man swab and our jail BJMP personnel for swabbing.
Doc Dulce from Leti Militante, what is our actual status of contact tracing since we have pending results? Why is it that there is a continuous increase in the number of suspected COVID-19 cases? Why did it take you more than 1 month to have an isolation facility?
Actually, we already have an isolation facility. El ano ganit diaton is those who are symptomatic to be here in Lantaka. And it doesn't, we also have to prepare our isolation facility. So as early as March, we already have identified our isolation facility. But it took a while because we have to have the basic necessities in place. We cannot just bring our patients in the isolation facility if it's not yet ready. So it amo siya di aton mga cause of delays, no? But rest assured that all of us, all of the agencies who are concerned are working para we will have our isolation facility ready. And what's the other question, attorney?
Cosa el actual status del contact tracing?
Actual status del contact tracing. Even LD aton mga suspected cases palang gani, no? LD ilang mga close contact, taas siya kita entra na di aton monitoring. So now that we have more confirmed cases, so tan increase LD aton contact tracing to be monitored.
Okay, Doc Dulce, niya ba mga taong grasa kita man manifest symptoms de COVID since tali lang sila kalayat na di aton mga kamino?
So far, nuay man kita report, no? Siya ni kita yesterday, pero tan clear out pakil kita si siya negatle COVID symptoms. And siya na taman niya asaya gani mga esperso si Ma'am Soki di aton to contain them, no? So man strengthen lang kita kel so that we will have an area wherein we will be able to put them and take care of di aton mga taong grasa.
Doc Dulce from Santos Cortez, kusel update del mga pending test kaya imbya kita na Manila or Davao?
So we are waiting for the result because we really do not have control with these laboratories. Once we sent the sample, once we send the sample to the laboratory for testing, talyayakal na diilahan, no? So we do not really have, we cannot also demand that our samples, because they also have samples to be tested from their area on the silatan serve. So although we can follow up si Kosay al status di aton mga samples yan send kita, pero cuando sila man run ko na kel is really na di ila control, no ay na control di aton. No? So tabla gani EOS di aton we have 137 samples pending pa. So hopefully in the coming days we will be able to get the results of these already.
Doc, do you have data on the release of PDLs? Kay tabla si Santos Cortez, tiyan daw un kaso na San Roque. Do you have any idea about this, Doc?
Okay. Tiyan mga PDLs yan release LBJMP before we had ZC09. No? So, tiyan man mga release orders LD aton mga PDL even before. So, no? So, por eso, tiyan kita sa mga PDLs who are already in the community because they are not subjected. No, masikitas naman kanila because that the release of these PDLs was before we had a case in BJMP LZC09 di aton. But just the same, akal mga close contact di aton mga confirmed cases, even if they are in the community already, we have followed them through. No? So, anda kita man trace, on the base, sa mga pwede facility. And amo gani yan turn out na positive tamen LDC result, but he's now in an isolation facility. So all the rest of the PDL who were also released before LZC09 di aton, that we saw that pwede sila, they are high risk also to have the infection, we are monitoring them.
Doc Dulce, we have a question from Bong Simbahon. There was a council resolution to accommodate medical frontliners in hotels. How come only those from the Zamboanga City Medical Center were accommodated while other hospital workers go home to their families after duty, which makes them vulnerable to contamination?
So actually yadali kita na ZCMC because they are the COVID referral hospital. So LS na mga health workers ti aton that are billeted in our isolation facility, these are the ones that are really taking care of our COVID confirmed, no? So sabi kasi yung attorney, el mechanism di ato, no? So, all of the hospitals, private hospitals, see for example, na sila suspected COVID case, at can refer kita na di aton COVID referral hospital if they are manifesting with moderate to severe case. Chene otro, tabla gani kita, tan mandatory quarantine kita, no? So, we have an isolation area ready for them, but el otro si chene area tamen that won't kera sila nakasa tamen man home quarantine, basta make sure lang na they can strictly comply with our room quarantine rules, so pwede tamen actually sila man quarantine na kasa. Si chene gani mga health workers na private hospital na high risk of having the infection because they took care of those who are confirmed, na pwede sa sila man labi na di ila mga private hospital supervisors or managers because they are also mandated to look for a place on the pwede man quarantine LD ila mga workers.
Doc Dulce, clarification, akil na mga PDLs for release, donde imbia LD swab specimen? Na Zamboanga City Medical Center ba?
Na SPMC, na Davao. We are going to send it na Davao.
Kilaya el contact tracing na akil mga nuayman swab test, mga suspected COVID deaths. What if positibo galikel? Hindi ba makamiedo se according to Theodiver?
Once tani kita suspected deaths already, taabla tamen kita because ta-enter sa na di aton database, close contact di ila na family, takeda di aton persons under monitoring, even if noy masyagani sa na di aton no classification, but tan monitor, ta-enter sa na di aton database kung ken kita tan monitor. Until there, el result will come out. Akal mga kanya murigan niya, pwede sa ka el result.
From Bong Simbahon, Doc Dulce, what is the trend now inside our City Reformatory Center? What is the trend also in the COVID suspect and positive figures?
So, for the last days, we have not received confirmatory results. Si Chenegani kita positive. So, we still have 137 pending. Right now, together with our BJMP health personnel and all the personnel,
Doc, dali pa to, Doc. Okay, so maybe we can try to go back to Doctora. Now I will just answer some other questions. We have questions from Theodiver Arquisa na distribution del welfare assistance, quarantine pass el basis, pero hindi todo familia tiene. Ta produci pa ba kita el magapalta? So kini kita ase klaro, el diato na City Social Welfare and Development Officer gani ayer na session niya abla que el base, el con todo pronto, para pwede kita man-deliver dayon el diaton relief goods, el diaton quarantine passes. Pero sabi también kita, kay Chenegan ng mga barangay, donde no sila sigi en buenamente con el distribution, o yapalta gayot el número del mga quarantine passes. Pero mas mucho syempre el suficiente el número. Aquel na mga barangay donde yapalta el diaton quarantine passes, pwede sila laman na diaton hotline. So talise na Facebook page del diaton alcalde, donde gane pwede sila habla si cosa el dila identificación, el dila nombre, el dila barangay, kay mismo el diaton na mayor's office, el barangay affairs division diaton, amo el man respond kanila, no? So amo sa el diaton na response para pwede kita asigura que todo familia tiene ay recibi con el diaton ayuda. Y el question di RG go acerca el gastos na diaton rice, water and electricity. Pwede kita contigo dale no based na diaton supplemental budget number 2, aloka el gobierno local el fondo de 263,816 and 273 pesos para con el diaton welfare goods. So estabaste na bayanihan grant donde ganaya dale el share di aton na from the internal revenue allotment. 1 month share di aton internal revenue allotment. So do we have Dr. Dulce back? Dr. Dulce, can you hear us?
Yes.
Yeah. So you may continue, Doc, as you were saying.
So, tablagan kita el testing di aton. We have 137 pending results yet, no? So, once we have the results of these already, and akal mga yan swab kan kita additional na di aton City Reformatory Center, then we will be able to really establish el di aton actual trend.
Okay, Doc. We have a question here from Julie still. Per netizens' reaction, can these kita mentally disturbed persons no, who are roaming in our streets, can they be part of the city's health concern? Can we have a facility made available to them?
We are actually identifying a facility where to contain them.
Any update on that, Doc?
So naipagani kita sa ondegat kanila po ni, and we are also preparing tamen el mga manpower who will look after them.
Okay, Doc. Doc, there is a question here. Can we bury COVID-19 patients who died can we bury them in private cemeteries?
Yes, we can bury them in private cemeteries.
Okay, thank you, Doc. We have a question for BJMP, SJ1 Comprendio, sir. Cuánto del mga 44 PDLs positive? I think this is not the exact number now, but how many of those who are confirmed to be positive cases have release orders already?
Yes, as per record, total del 234 due for release, 5 aquí el positivo.
5 el positivo.
5 el confirm positive
Okay.
na COVID.
Thank you very much.
Yes, okay.
Magatiempo, quiere kita rin di gracias con el diaton mga resource persons. Tarde na diaton press conference, Dr. Dulce Miravite, our City Health Officer, Dr. Elmer Jade Apolinario, our City Disaster and Risk Reduction Management Officer, Dr. Justin Paber, the spokesman of the Zamboanga City Medical Center, SJ1 Ray Lawrence Comprendio, el portavoz del diaton City Reformatory Center, el mga personajes del Zamboanga City Electric Cooperative, Engineer Frederick Baco, Mr. Bernie Barliso, Mr. Rowie Endaya, Engineer Mel Chu. Y también tadali kita diaton saludo con el diaton mga frontliners que tatrabahan na diaton mga ospital y otro pa mga fasilidad, el gobierno local del ciudad de Zamboanga na encabezamiento del diaton alcalde Ben Climaco, tarindi gracias por el de ustedes sacrificio. Ita continua kita, pidi con el diaton mga vivientes, pabor dale el de ustedes cooperación y entendimiento mientras taase kita con el diaton pelea contra el Covid. Esta kita na casa, isita sa kita afuera, continua usa el diaton mask, iman observe kunel social distancing. Acerca el mga updates na diaton na COVID response y también na distribution del mga relief goods, ay espera lang ustedes con el mga anunsyo na official Facebook page del diaton alcalde y también del gobierno local del ciudad de Zamboanga. Muchas gracias y buenas tardes a todos.